Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 30 of the Ask Dr. Angela podcast. I am, as MJ would say, working day and night between the podcast, the blog post, doing the final editing on my pregnancy book, and just, being a mom. It is crazy busy in my realm. But if I'm not busy, there's something wrong. Anyway, let's jump right into today's question, which is a really good one, considering that October is Breast Cancer Awareness Month.
Do I need to be concerned that I have dense breasts?
This is a really excellent question, and I'm going to assume that because you just asked me about dense breast, that you've had a mammogram, because that's an observation that people make when they're reading any kind of mammogram findings. So first of all, good for you for getting your mammograms. Who should be getting mammograms? Anyone that's over the age of 40. When should mammograms start? Typically at the age of 40. For those of you with a family history, specifically a first-degree relative with breast cancer, we typically will start doing mammograms on you 10 years prior to the age of that affected relative's diagnosis. So say, for example, if you have a mom that was diagnosed with breast cancer at the age of 40, your mammogram screening would start at the age of 30. Having said that, I'm also going to give a plug for breast awareness. And what I mean by that is just generally knowing what your breasts look and feel like. That's really important, and I promote this to a lot of my young patients. Touch yourself, touch your breasts. They are a part of you. And so typically and generally knowing what your breasts feel and look like is important, because if they look different or they feel different than what you're accustomed to, that should certainly raise an eyebrow. With regards to the timing of when to do your self-breast exams, I typically recommend the week after your menstrual cycle, so that you are not dealing with a bunch of the pain or lumpy, bumpy fibrocystic findings that can be associated with hormonal changes that are very common around the time of your period. Having totally introed your question with all of that information, let's get to your question. Dense breast tissue, what does it mean? So as I previously mentioned, because you said to me that you have dense breast tissue, that lets me know that you've had a mammogram, because dense breast tissue, if someone says that your breasts are dense, that lets me know that they've kind of made an observation of how your breast tissue is appearing on this mammogram finding. So what you need to know about your breast is that it's composed of a couple different things, milk glands, milk ducts, supportive tissue, fatty tissue, etc. And when you view these things on a mammogram, what the radiologist is going to look at is the amount of fat tissue that shows up versus what they consider dense breast tissue. Dense breast tissue on mammogram shows up like kind of very solid and white. It's much more difficult to see through, whereas non-dense tissue, for example, fatty tissue, is going to show up darker on mammogram. The issue with breast tissue being dense is that it certainly can make detecting or finding an underlying cancer more difficult. So oftentimes women that have dense breast tissue will be asked to go for additional imaging, whether that's something like an ultrasound. Sometimes women are asked to go for MRIs. Sometimes women are asked to go for 3D mammograms or breast tomosynthesis. Having dense breast tissue really is I'm not even going to say kind of. Having dense breast tissue is really just a pain in the ass, because, again, it oftentimes makes you have to get this additional imaging done just to make sure that everything is okay. Again, dense breast tissue makes reading mammograms a lot more difficult. And because sometimes, the density of breast prevents the radiologist from seeing what they really need to see, they will oftentimes order this additional testing just to make sure that everything is going okay. Not all women have dense breast tissue. Certainly, some things that might make you more likely to have dense breasts are going to be things like being young. They say that the older you get, the less likely you are to have dense breast tissue, but you can have dense breast tissue at any age. Premenopausal women are more likely to have dense breast tissue. And certainly women that take any kind of hormone replacement therapy are also going to be at an increased risk for having dense breasts. I'm really, really, really happy that you submitted this question, especially since it's like October, which again is Breast Cancer Awareness Month. So thank you again. I really appreciate the continued support. Because we did feature your question on the Ask Dr. Angela podcast, someone from my team will be reaching out to you to send you one of our bomb ass t-shirts. For those of you that are listening and would like to have a question featured on the Ask Dr. Angela podcast, please go to www.askdrangela.com. That's ASKDRANGELA.com. Click on the microphone that's on the right-hand side of the page and do what you do. In closing, I'd like to leave you with this. Everybody wants happiness. Nobody wants pain. But remember, you cannot have a rainbow without a little bit of rain. Thank you so much for joining us. I can't wait to reconnect. Until next time, look better, feel better, be better. See you for episode 31.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.